Okay, so we will start now. So thank you everyone for joining today's webinar. I am Rasha Fadlallah and I'm a Senior Evidence Lead Specialist at the Knowledge to Policy Center at the American University of Beirut in Lebanon. I will be co-facilitating today's webinar on policy brief writing along with my colleague Rana Saleh.
Hello, my name is Rana Saleh. I'm the Advocacy and Evidence Lead Specialist at K2P Center at the American University of Beirut.
As you know, this webinar is being offered as part of K2P Mentorship Program. So before we start, I just want to mention that the webinar will be recorded. So for clarity purposes, we would appreciate it if you can mute yourselves, and please feel free to unmute yourselves anytime along the way if you have any questions or clarifications. Okay, so in today's webinar, we will be covering the following. So what is a policy brief and what are its unique attributes? What are the steps involved in preparing a policy brief? And what are the appropriate types of evidence for developing a policy brief? So for those of you who have attended the workshop in Beirut, this webinar will serve as a key refresher before starting with actual production of your own policy briefs. So broadly speaking, policy briefs are one of the most widely used knowledge translation products for packaging and synthesizing research evidence for policymakers and stakeholders. And knowledge translation products, as you know, they allow research evidence to be packed in a user-friendly format and to be written in an easy-to-understand language, which would increase the likelihood of the evidence being used by policymakers and stakeholders. So how do policy briefs differ from other types of research documents? Policy briefs have 5 unique attributes. So in terms of the audience, policy briefs are geared towards policymakers and stakeholders who have a limited amount of time to make a practical decision. So when we write policy briefs, we write them with the end users in mind. In terms of the tone and terminology, policy briefs use clear and easy to understand language. So it's very important to avoid unnecessary jargons or advanced statistical data. So it is rare for you to find policy briefs where the findings use risk ratio, odds ratio, confidence intervals, or statistically significant associations. This is because you have to remember that policymakers are lay people. And in most cases, they might not be able to interpret these statistical data or they might interpret them wrongly. So it's very important to avoid the statistical data and rather to write the interpretation of these data. In terms of the purpose, so policy briefs are action-oriented tools to help readers decide what they should do. They are specifically designed to inform decision-making. In terms of the format, policy briefs put strong emphasis on the policy context and the application or the interpretation of the research findings as opposed to the research methodology or the analysis. That's why if you look into policy briefs, we don't have an explicit methodology section. Instead, we put the methodology in a side box because the emphasis is on the context and the interpretation of the findings themselves. And of course, unlike research, in policy briefs, we involve the end users as part of the development process. So once you have an outline of your policy brief, you would select 6 to 8 key policymakers and stakeholders to elicit their inputs on the different features of the policy brief. This is important as it will help ensure that the policy brief resonates with your end users and it really speaks to your own context and systems constraints. And it's important to acknowledge that if you look into the literature, you will find that policy briefs may vary in terms of the content and the format. But for the purpose of today's presentation, the term policy brief refers to evidence-based policy brief or evidence brief for policy as adopted by EVIPNet, which is the Evidence-Informed Policy Network that is sponsored by WHO and that encompasses more than 36 countries, including Canada, Chile, Argentina, Lebanon, Uganda, Nigeria, and other countries in East Europe. And we have ample evidence showing that these types of policy brief are highly valued by policymakers from high income, middle income, and low income countries. And when disseminated properly, they have been shown to achieve impact across topics and contexts. So how do we go about preparing a policy brief? So once an issue is prioritized, so let's say you did a priority setting exercise and you have identified a policy relevant priority topic. The focus then turns to finding and synthesizing all the full range of evidence relevant to the various features of the issue. And this is where the policy brief becomes critical, as it brings together global research evidence from numerous systematic reviews, local evidence from primary studies, reports, indicators, as well as context-specific knowledge from the key informant interviews with your selected policymakers and stakeholders, with the ultimate aim of informing deliberations about a particular health issue. In other words, this policy brief can serve as a one-stop shop, bringing together the full range of evidence relevant to that particular issue in order to facilitate the decision-making process. Typically, when you start writing a policy brief, you start with the problem statement. So you describe the problem, including the size and its underlying causes. Once you develop the problem statement, the next step is to propose 3 or 4 policy options or elements to address the problem. So you can either propose, so depending on the topic, you can either propose 3 or more policy options related to the topic. So if I want to address dental caries in Lebanon, one option can be salt fluoridation. Another option can be water fluoridation. So in this case, you are giving policymakers options. It's either this or that. Alternatively, you can describe 3 or more elements of a comprehensive approach. Here, the elements, they complement each other. So it's not either or. Ideally, they should be implemented together. So let's say you want to promote rational drug prescribing in your country. One of the elements could be targeting national level policies to regulate physician-pharma interaction. This can be complemented by organizational level policies requiring the implementation of clinical guidelines. And these can be complemented by professional level interventions related to the education of professionals. So in this case, the elements, they complement each other and they form part of a comprehensive approach. So we start with the problem statement. We then propose 3 or 4 policy options or elements to address the problem. And then we conclude with implementation consideration. So for each of the policy options or elements that I propose, I have to mention to the policymakers what are the potential barriers that they might face. And more importantly, I have to propose counter strategies to overcome those barriers. This is because if I only stop at the barriers, this might actually hinder or discourage policymakers from adopting a given policy because they might be discouraged. I am complicating things for them. So that's why for every barrier, you should propose counter strategies to overcome that barrier in order to facilitate the decision-making process. So my question to you, what is not included then in a policy brief? Anyone that would like to answer?
Recommendations for exactly what the policymaker should do.
Exactly. So in a policy brief, we do not provide recommendations for action. Instead, as I mentioned earlier, we provide 3 to 4 policy options or elements, and then the policymakers would then decide on the best combination of options or elements that they would like to adopt and implement in their context. So you give them some power over the decision-making rather than imposing your recommendation on them. So it's true. So in a policy brief, we do not provide recommendations for action. In terms of the format, so policy briefs, they usually follow a graded format. So we typically follow the 1-3-25 format. So you start with the key messages, followed by executive summary, and then the full brief. And I want to emphasize on the importance of key messages because unfortunately, 80% of the times, policymakers end up only reading the key messages. So it's very important to ensure that you craft them in a way that your key findings and the take-home messages are actually conveyed in the key messages. And in fact, when we send our policy briefs to policymakers and stakeholders, we tell them, if you have 5 minutes, please read the key messages. If you have 10 minutes, please read the executive summary. If you have 30 minutes, please read the full brief. So in the next few slides, we will be elaborating on the different sections of policy brief writing, which is the problem statement, the options and elements, and the implementation consideration. Before I start with framing and clarifying the problem, I would like to stop and see if any one of you has any question at this point. Okay, so if there are no questions, maybe we can proceed. So a critical starting point in informing decision-making process is to have a clear framing of the problem. This is because the way you frame your problem will ultimately dictate whether and how your policymakers and stakeholders will address and respond to that problem. That's why it's very important to draft the problem in a way that will resonate and appeal to your policymakers and stakeholders. If you cannot convince them of the urgency of the issue and the need to address it, then you simply cannot expect them to buy into the proposed policy solutions. That's why framing the problem is very important, and it actually takes time. It's an art. So I'm going to start with an example. So these are two statements. So maybe we can take 5 minutes for you to read these two statements, and then you can answer which of the two you found more appealing and why. So would anyone like to answer? Maybe we can wait another 1 minute.
Okay, I'd like to, I prefer statement B.
Why is that?
Because it gave, in trying to bring out the burden of the problem, it gave some background to the influx of the refugees, and then brought out the problems posed to the health system, including the rise in communicable diseases, risk of epidemics, control of chronic illnesses, and all that. As against statement A, that it didn't really bring out the problem, such that someone reading it can immediately see the areas that one can focus on to bring about results.
Yeah. What else? Who found statement 1 more appealing? Statement A more appealing? Any volunteers? So statement A or statement B? You can also write in the comment box if you don't prefer speaking. B. Okay, so most of the participants are saying statement B. So yes, so statement B is actually the problem statement that we have used in the brief we have developed on promoting access to Syrian refugees in Lebanon. So if you look at statement A, it's good, okay, but as a policymaker, why should I care? It doesn't tell me why I should care about this issue in Lebanon, whereas If you look at statement B, so let's analyze it statement by statement. So the constant and large influx of Syrian refugees in Lebanon due to the escalating Syrian conflict has put a great pressure and burden on the Lebanese healthcare system and economy. So in the first statement, I have contextualized the evidence. I have told my policymakers why you should care about this issue, because it's happening in my own country and my context. Let's look at the second statement. While there are many humanitarian organizations and governmental agencies involved in providing assistance and healthcare services to Syrian refugees, the existing arrangements within the system are limiting access of refugees to essential healthcare services. So this is very important because I am acknowledging existing effort, and it's very important and critical for you to acknowledge existing efforts if at the end of the day you want all the different policymakers and stakeholders to come together around the table to deliberate and reach meaningful solutions. So if you don't acknowledge, so if we haven't acknowledged existing efforts, many of the NGOs would have come with a defensive approach. They would have come simply to defend their status rather than contributing to meaningful discussions. So it's very important to acknowledge existing efforts and then pinpointing to additional gaps that you might need to cover. And look at the third statement. This has led to a rise in communicable diseases, increased risk of epidemics, and suboptimal control of chronic diseases, in addition to maternal and child health problems. So I am telling them what is the consequences on health outcome. So what is the impact on health outcome? And this is very important. And finally, how can stakeholder organizations secure better access to essential and urgent healthcare needs of Syrian refugees? I'm making the case. So it's very important. Okay, it's not changing. So it's very important when framing the problem, you have to ensure that it's evidence informed, it's contextualized, and it's engaging with a focus on health and economic outcomes. So this is another exercise. So let's say you are working on promoting rational drug prescribing in your own country. Which of the three problem statements would you include as your own problem statement in the policy brief? There's no right or wrong answer, but so we can spend another 5 minutes and then we can discuss and deliberate. Okay, so who votes for problem statement 1? What about 2 and 3? So which of the problem statements would you prefer? So we have 2 individuals saying 2. We have 1 individual saying statement 3. Okay, so 3 individuals voting for 2 and 3 individuals voting for 3. Okay, so maybe we can perhaps we can start with problem statement 1. So why didn't any one of you choose 1? What's wrong with 1? So problem statement 1, pharmaceutical company likely influenced the prescribing habits and professional behaviors of physician. And there is also concern that in paying for doctors' education, drug companies will influence physician behavior for the financial benefit of the company. This is excellent and this is something important. But why should I care? You didn't tell me how this relates to my own country or to my own context. So as a policymaker, I will not care. This will not appeal to me because you did not contextualize the evidence. So now we're gonna move to problem statement 2 and 3, and we want your participation. So those who said 2, why did you select 2? And those who chose 3, why did you select 3? Any volunteers? For those who selected 2, why did you choose 2? Hello? Two defines the problem in detail. Okay, so in fact, when we started writing this policy brief, we initially selected 2 as our problem statement. But guess what happened? So, of course, when we're talking about the issue of rational drug prescribing, physicians are our number 1 target audience. So when we sent that policy brief to physician, the first statement that a physician would read once he opened the policy brief is the problem statement. And if I am a physician and the first statement I read is that physicians' interaction with pharma industry is not subject to any form of regulation in Lebanon, how do you think I would react? Is this inviting? So the moment I read this statement as a physician, this has set the tone for me. So I will take the defensive position because you are blaming me. You are not inviting me to a discussion. And most probably as a physician, I will end up not joining you or not coming to the dialogue later on. I will not take part in the discussion and trying to come up with a solution to promote rational drug prescribing in Lebanon. So in fact, when we sent it to physicians, they expressed they did not like the way it's framed because it did not invite them and it was blaming them. So we eventually ended up rephrasing problem statement 2 into problem statement 3. If you look at problem statement 3, we started with the outcome. So the inappropriate prescribing of pharmaceuticals in Lebanon increases the risk of serious adverse effects and drug-drug interaction, promotes drug resistance, and leads to unnecessary increased costs on patients, government, and the community at large. The current health system arrangement do not fully promote prescribing of drugs in Lebanon. So in problem statement 3, we did not blame any particular individual. We looked at the issue from a systems perspective. And in fact, if you look back into statement 2, it is one of the solutions to promote rational drug prescribing. It's the physician-pharma interaction regulation. So we included this problem statement 2 eventually as part of the policy options or proposed elements. So rather than having it there from the very beginning, where it might create friction with some of your key stakeholders, we put the statement from a systems perspective, and then in the options, we said that, by the way, one of the ways to promote rational drug prescribing is to regulate physician-pharma interaction. In this way, we were able to bring all the key stakeholders together to the table to discuss and deliberate and agree on an action plan to promote rational drug prescribing. So it's very important to avoid blaming individuals and to avoid putting solutions as part of the problem statement, because at the end of the day, the problem is about rational drug prescribing. What do you think? Any reaction? Does anyone disagree? So this is actually based on our actual experience. So I'm gonna move on. Okay, so when framing the problem, there are key questions that it's important to keep in mind. So first of all, you have to ask yourself, how can the problem be framed in a way that will motivate your audience? The first thing to do is to identify my audience. So who are my target audience, and how can I frame the problem in a way that will motivate my target audience? So let's take the example of access to care for Syrian refugees. So if you frame the problem in terms of rises in communicable diseases and epidemic threats, it would most probably resonate with public health professionals. If you frame the problem in terms of lack of policies to protect the right of refugees to access basic health services, it would most likely resonate with non-governmental organizations and activists. If you frame the problem in terms of comparing your country's performance to other countries' performance and showing that you are in fact lagging behind, it would most probably resonate with policymakers. And in fact, our experience have shown that policymakers are really triggered when you try to frame the problem and show them how they compare, how their country is performing compared to their peers. So this really triggers policymakers to take action. Another important question to consider is, how did the problem come to attention? So why is this a problem now? Focusing events, they actually serve as windows of opportunities for action. So when we were working on the policy briefs on medical errors, this was actually prompted by a focusing event where a 5-year-old underwent double amputation as a result of medical error. And overnight, everyone in Lebanon was talking about the medical error, including the media, the public, policymakers. So it was brought to the forefront of debate, and this opened a window of opportunity for us to act on this issue. Of course, sometimes changes in indicators can also prompt you to take action regarding a specific issue. So let's say suddenly you find that you have high prevalence of mental health in your country, which exceeds regional prevalence. This might prompt you to take decisions and act on the issue of mental health. Another key question to consider is, what indicators can be used or collected to establish the magnitude of the problem? So policymakers, they love numbers. They find numbers appealing. So whenever possible, try to quantify the size of the problem. Try to use percentages. Of course, you can use surveys, administrative data, primary studies to quantify the problem and the size of the problem. Another way to establish the magnitude of your problem is to use comparisons. So you can compare your country's performance over time, or you can compare your country's performance or situation to other peer countries or neighboring countries, or you can compare your performance against the country's national target goal. So these comparisons are very important and appealing to policymakers. So try to use comparisons as much as possible. Another key question to consider is, what are the consequences of inaction? So if we do not act on this problem, what are the consequences? What is the price that we will pay? And of course, what is the impact on health and economic outcomes? Your problem statement should always try to reflect the health and economic outcomes of a given policy issue. So these are some of the key questions to keep in mind when framing the problem. So once you have clarified the problem, the next step is to identify the underlying causes of the problem. This is because if you really want to make meaningful impact and sustainable change, you really have to identify and address your underlying causes. So if I have high prevalence of medical error in Lebanon, if I want to address this, I should ask myself, what are the underlying causes contributing to this high prevalence? Because believe me, no physician wakes up in the morning and says, today I want to kill patients. So rather than blaming our physicians, we have to look at the health system arrangement. We have to look at the underlying causes, the way the system dysfunctions create an environment that is prone to medical errors. So you have to ask yourself whether a given program, services, or drugs. So when we talk about the underlying causes, we have to look at it from a systems perspective. So you have to ask yourself if the problem relates to whether the program, service, or drug, so you have to ask yourselves whether the problem is related to the governance arrangement, financial arrangement, or delivery arrangement of the health system. In terms of governance arrangement, you have to look at the stewardship function, the accountability systems in place, the incentive systems. In terms of financial arrangement, so is it related to how physicians are reimbursed, to how services are covered? In terms of delivery arrangement, is it related to how services are provided, by whom they are provided, where they are provided? So you have to really analyze the problem from a health system perspective and lens. Sometimes you might have a policy or a law in place, but the problem is with the poor implementation or enforcement of that policy or law. And this is an example on inappropriate prescribing of drugs in Lebanon. So we had high prevalence of inappropriate prescribing in Lebanon. When we analyzed the underlying causes, we found that at the governance arrangement level, there was absence of laws and legislations to regulate healthcare provider pharma industry interaction. We also found that there was weak clinical governance at the level of healthcare organizations, meaning that many healthcare organizations, they lacked standardized clinical guidelines, they lacked pharmacy services or systems for prescription audit and feedback. Additionally, at the level of education, we found poor integration of curricula and trainings about drug promotion and pharmacology in the undergraduate curricula. Moving to the financial arrangement, we found that there are no proper incentives systems to encourage generic drug use. We also found that physicians, particularly those in the private sector, are paid on a fee-for-service basis, which of course would create incentives for them to prescribe expensive brand name drugs. At the delivery arrangement, we found that in many hospitals, there is a culture that is accepting of physician-pharma interaction. We found weak institutional policies on conflict of interest and poor involvement of patients in decision-making related to medication use. In terms of degree of implementation of an agreed course of action, we found that although we had a code of ethics for medicinal product promotion in Lebanon, there was problem with the enforcement of that law. So this is so it's very important for you when identifying the problem to diagnose the underlying causes, because at the end of the day, you want to address these underlying causes to make meaningful impact. So sometimes your problem might relate to only the governance arrangement, or maybe only financial, or maybe only delivery, or maybe it's related to the implementation of an existing law or policy. So it doesn't have to include all the different arrangements. It really depends on the problem. So what are the appropriate types of evidence for framing the problem? So when drafting the problem statement and the underlying causes, what types of evidence do you look for? So someone said systematic reviews. What do you think? When framing the problem and underlying causes, do we use systematic reviews? Yes? Does anyone want to answer?
I would want to look at evidence from the local context. So if there are any surveys, any administrative details from administrative reports, or primary research studies for the particular country, because the problem is really country specific. So I would want to put that type of data and statistics and numbers from the local context as opposed to a systematic review study.
Exactly, excellent. So as we mentioned, the problem is contextualized to a country. So ideally, you should look for local evidence when framing the problem, the size of the problem, and its underlying causes. So as you've mentioned, so some of the databases to look for include local primary studies, surveys, governmental reports, administrative data, and regional studies for comparison purposes. So the ideal type of evidence is local evidence because the problem is contextualized. It has to speak to your own context and to your own problem. So we have drafted the problem and its underlying causes. The next step is to look at policy options or elements to address the problem. So before we move into the policy options and elements, do you have any question? So my colleague Rana will now will take over the options and elements if you do not have any questions. Okay, Rana, do you want to move on? So yes, if your systematic review is restricted to your own country, then definitely you can use it as part of quantifying the size or prevalence of the problem. Can you use primary data? So definitely, so primary data is one of the key data that you should use. And sometimes maybe you might not have a population or representative data, but you might have some scattered data from different observational studies. But if this is the best available evidence, then you have to use it, and you just have to acknowledge the policymaker that this is the best available evidence. It doesn't mean that I will not address the problem because I don't have enough data. In fact, there is nothing known as complete evidence. You will never find complete evidence, but you have to work around the best available evidence and move from there. Okay, so Rana, do you want to?
Yes, thank you, Rasha, for this elaborate explanation of how to develop the problem and the underlying factors. The most important part of the policy brief is definitely the problem definition, because it addresses the real problem of why stakeholders should find solutions to this problem. What are the solutions that we are portraying in this policy brief, and how to develop them, where to search for evidence, and all the other details on how to draft those policy options will be addressed in this section. The policy options and the elements are very important in the policy brief because they will provide the evidence that a policymaker needs to have an informed decision on how to continue about a decision or take an action to solve the problem. Policy options are characterized by being evidence informed. That means that they should be identified from evidence, and they should not be subjective and identified from the personal interests of policymaker or even the researchers themselves. They should be identified from the best available evidence from high quality systematic reviews identified locally, regionally, or even internationally. These systematic reviews are then identified and synthesized to clarify what are the options to address a certain problem. These options should be synthesized in a way that is clear and concise and user-friendly for all the policymakers in order to give them all the information they need to make a decision. What are the policy options and what can be identified as an option or as an element? It could be simply to introduce or change or to discontinue a current program, service, or a drug. So for example, if our problem is the inappropriate prescribing, those policy option could be starting an antimicrobial stewardship programs at the hospitals. For example, it can also be addressing a certain health system arrangement, such as governance arrangements, financial arrangements, and delivery arrangements. This section should speak to the underlying factors that was shortly outlined by Rasha. So once you identify that you have a problem in the governance arrangements, that for example, there are no coordination between the different sectors working on a solution for childhood obesity, then you should address a coordinating body to gather together all the stakeholders working on childhood obesity at the governmental level. For example, if your issue is financial arrangements and you don't have enough funding for projects for NCD prevention, then your policy option could address those financial arrangements through identifying different mechanisms of identifying funds that are sustainable. If your problem has a certain aspect to it that is reflected as a delivery arrangement issue, so for example, having limited number of physicians addressing mental health at the primary healthcare level, then your delivery arrangement option could be task shifting to nurses and to other primary healthcare physicians that could identify mental health issues. For example, if your problem as well is a certain policy or a law that is there, however, it's not implemented properly or not implemented at all, your policy options could address ways to implement those policy options. As an example, the inappropriate prescribing of prescribing quality and patterns of drugs have been solved by the current policy options identified in the Lebanese context. Number one was to regulate the healthcare professionals' interaction with pharmaceutical industry, which is a system-level solution. The second one was integrating institutional interventions, including standardized clinical guidelines, clinical pathways, and systems for prescription audit and feedback. This is at the institutional level solution. The third one was promoting the education of healthcare professionals about conflict of interest, problem-based training on pharmacotherapy, and academic detailing on, to support rational prescribing. So this is a solution at the level of the healthcare professionals. And the fourth one was to empower and educate consumers themselves to ask for appropriate medication prescribing patterns and medication use. So as you can see, those four options or elements identified the main solutions for the underlying factors that were really highlighted in the context. So in the context, it was really about the interaction between pharmaceutical industries, having no institutional interventions, and limited awareness among healthcare professionals and consumers. As such, the policy options were identified from the literature that they were evidence-informed, however, speak to the context. This is very important consideration while developing the policy options. They have to be identified from the literature, yet they should speak to the context of what is the real problem in our context and how we can solve it in a way that can be implemented in the context. How do we reach to those four big titles? There is a process of how we reach to those. Usually it takes some time to identify them. However, the regular process that we usually use is that once we identify all the underlying factors of the problem, we develop a search strategy that is either generic for the problem on how to find solutions for the problem, or it can be very specific, identifying solutions for each underlying factor. Once we gather all the evidence about those systematic reviews addressing the options and the solutions for the problem and the underlying factors, we screen them quickly, we identify, we learn more about what the evidence is advising us as solutions that have been implemented elsewhere and has been shown to be effective in different contexts. After that, once you identify all the literature, you will start categorizing the different options into big umbrellas. So as you can see here, we categorize them based on system level solutions, institutional level solutions, and educational and awareness level solutions. You can choose the categorization that you deem necessary and feasible in your context and depending on the problem that you are addressing. Once you identify the categories that you want to highlight, then you can move forward to working more on the details of those policy options in order to identify all the needed information for your policymaker. What are the certain information that a policymaker really needs in order to make an informed decision? This is an example of the tables that are included in a policy brief, and these outline the main information that a policymaker requires in order to make an informed decision by the best available evidence, which includes the benefits of a certain policy option. So for example, you have to outline that for systematic reviews specified that antimicrobial stewardship programs are effective in improving the prescribing patterns of physicians. For example, so you have to identify what is the benefit of a certain policy option that I'm integrating in the policy brief. Also, you really have to identify all the harms that could arise from implementing a certain policy option. For example, implementing tobacco taxation has been shown to increase smuggling. So this is a potential harm that you should include in your policy brief. And it's a consideration that you should keep in mind, that you have to find solutions for this potential harm if you choose to implement taxation in your country. Policymakers love the information about cost and cost effectiveness. Sometimes you'll have the best solution to the problem, however, it's very costly, or if it's not cost effective, then your policymaker will not choose to implement it. As such, it's very important to identify the studies that have outlined the cost and the cost effectiveness of the certain policy option so that your policymaker can assess if it's possible for them to implement it in the context. Also, uncertainties about this policy option has to be highlighted. For example, if we know all the details about a certain policy option, there would be no uncertainty about it. However, if there are certain considerations that are not still very clear, you have to highlight that. For example, if we are addressing school policies for childhood obesity prevention, then we know that repackaging of the products that are sold inside schools is effective in improving the behavioral practices of children. However, uncertainties still exist on the portion size, on the shape of the package, on some of the other details. So these has to be highlighted in the policy option so that your policymaker would know that you would need more research before starting to implement it or during its implementation. The other category is definitely stakeholder reviews. If you identify the stakeholder opinions from different contexts, then you are more likely to identify how your stakeholders in your context would react to those certain options. So for example, if you know that citizens have decided that this option is not implementable in their context, then you would want to consider if this option is implemented in your context based on the citizens' views. So it's something that you should take into consideration as you implement this policy option. As an example, we will dwell more into the promoting education of healthcare professionals about conflict of interest and how to write these policy options in more details and how to write the table required in the policy brief. As you can see, the options has to be identified and segregated based on the benefits, potential harms, cost, and uncertainties, as we explained in a bit. However, they have to be drafted in a way that synthesizes the totality of evidence rather than summarizing each study individually. So for example, as you can see, we have written that 2 systematic reviews have found that the education about drug promotion in the form of seminars, role-playing, and simulation are effective, rather than stating that one systematic review or one study has said that seminars are effective versus another one that said role-playing is effective. The important thing about the policy options is that they synthesize the totality of evidence. So every single statement in the policy option has to start by the number of systematic reviews or the number of the studies that you have found that are supporting this policy option. For example, 2 Cochrane reviews and 4 overview of systematic reviews highlighted that academic detailing by trained health professionals is one of the most effective strategies for promoting appropriate care and improving prescribing behaviors. So as you can see, the evidence is very clear and is very strong, given that we have 2 Cochrane reviews and 4 systematic overviews of systematic reviews supporting this policy option. As such, policymakers would be more incentivized and more convinced that this academic detailing option should be implemented in the context. For example, for this element, there were no potential harms identified. As for the costs, one systematic review concluded that although academic detailing is costly, however, it is cost effective. Then policymakers would be also incentivized to implement this option, even though it's costly. However, the savings outweigh the costs of this intervention. The uncertainty, for example, two systematic reviews concluded that it is difficult to ascertain the long-term effect of educational interventions and behaviors due to short follow-up time of the studies. As such, you would understand that once you start implementing those interventions, you have to follow up for a longer time in your context. So it's very important to highlight all these information in the tables so that you'll know how to write the policy options in a way that addresses and speaks to your policymaker. Aside from those policy option tables, we usually write a summary of those policy options in a small paragraph that outlines the totality of evidence describing the benefits of the solution and the different key factors that have been shown to be effective across different contexts. For example, you would start the paragraph by 15 systematic reviews and 2 meta-analyses have identified, for example, that academic detailing is effective in improving the rational prescribing of physicians. And these should be implemented using seminars, role-playing, and simulations. So you would summarize the table, you would summarize all the findings that you have reached in one paragraph so that the policy maker can know what to implement at a later stage. Does anyone has any questions so far?
Proceed.
It's very important to highlight. So one of the questions was, what if some interventions have been shown not to work in some contexts, but have a high potential of working in contexts of which the policy options are intended? It's very important to highlight the different outcomes of a certain policy options implemented in different contexts. So ideally, you would choose the policy options that have been implemented in contexts similar to your context and have shown to be effective. For example, if a policy option, a certain policy option works in high-income country, not certainly it would work in low and middle income countries. As such, you would identify the systematic reviews that have been implemented in low and middle income countries to compare to your context and to extrapolate the results of it. That's one angle of it. The second angle of it is that systematic reviews usually and meta-analysis gather all the evidence from different contexts and try to find which elements of a certain policy option are effective in different contexts or across contexts. Then you would know which would be included in the policy brief. And that's why mainly the policy brief mainly relies on systematic reviews rather than single studies or primary studies. And also, a key feature of a systematic review is that it eliminates the risk of bias or reduces it considerably. As such, you would know that the policy options you're including in your policy brief are without a risk of bias. Another question is how much all of this elaborate info will go into 325 pages. So usually in the one page, we write a few lines about the problem statement, 2-3 statements about the underlying factors, and then we would outline the main policy options as you saw in a bit in the previous slide. As you have saw in this slide. So this is what we write usually in the key messages document. In the executive summary, which is 3 pages, we would elaborate a bit more on those by adding the totality of evidence that are supporting these options and the main key features. So it's practically a summary of the paragraph that I've just described. In the 25 pages, you would add all the details about the problem, all the details about the underlying factors, and all the details about the policy options, including the tables as well, and also the implementation considerations section, which we will describe shortly. Moving on now, where to find the evidence for the policy options. As we described in a bit, policy options should come from systematic reviews and meta-analysis or overviews of systematic reviews as the main source of evidence. If you don't have systematic reviews, then you would resort to primary evidence. However, you should state clearly in your policy brief that the option that you are identifying is not based on systematic reviews and based on primary studies, just to be clear and transparent for your policymaker to know. Usually, the section about the benefit comes from systematic reviews of effectiveness. The harms come also from systematic review of effectiveness or observational studies. The costs come from cost effectiveness analysis. Adaptations usually come from qualitative studies and systematic reviews of qualitative studies, similarly to the stakeholder reviews as well. Rasha, in the last webinar, identified how we can identify these systematic reviews, what databases we should look into. So I advise you to go back into the previous webinar to identify how we can reach to all of those systematic reviews and apply them to the policy options section. Before moving into the implementation consideration section, does anyone have any question? Yeah. Now that there seems to be no questions, we will move into the implementation considerations section. The implementation considerations section is the section that you will identify all the context-specific details on the barriers and the facilitators of implementing those policy options outlined. And this is a very important section because sometimes you would see policies that are developed on high quality evidence that are very strong and very rigorous. However, they fail to describe all the implementation considerations, the barriers to implementation, and how to overcome those barriers. As such, those policies are not adopted properly or not implemented or do not reach to the outcomes that we desire for them to reach. As such, it's very important to invest time into the section of implementation considerations. What do we usually add in this section? We identify, based on evidence, the barriers at the different levels of the system and also the stakeholders who will use these options later on. So we identify all the barriers at the patient or the citizen level. For example, lack of awareness about the availability of a free program for the citizens. We also identify all the barriers at the level of healthcare workers and professionals. For example, if you have problem with adhering to guidelines at your country. We also identify barriers at the level of the organization, such as managing the high quality care and the performance. Also, similarly, we identify barriers at the level of system and sociopolitical reasons and considerations. For every single barrier, we have to identify facilitator for this barrier. Otherwise, policymakers will hear noise rather than music. And we want them to feel like all of those barriers have an option in order to overcome those barriers. Otherwise, they will not be incentivized to adopt a certain policy option. For example, for improving the inappropriate prescribing of drugs, at the level of the patient, we know from the literature that patient refusal to be involved in shared decision-making can be a certain barrier. How to overcome it? In certain contexts, they have developed national health services and campaigns. It's okay to ask campaigns to encourage patient involvement in the care. For example, at the level of the professionals, clinicians who believe that there is a little evidence of harm from interacting with the pharmaceutical companies resisted the policies in different contexts. As such, counter strategy for that would be to educating those physicians about all the consequences of the pharma interaction with their or for their practices at a later stage. At the organizational level, a barrier was identified, including cost and time constraints that may hinder education and training for the professionals. As such, a counter strategy would be to allocate pre-specified funds and time for training the healthcare providers. At a system level, there is a problem, for example, about the weak collaboration between the different professional bodies. As such, there should be a strong leadership and willingness to cooperate and based on a common agenda and common goal and mutual support and proper communication lines. So as you can see, those implementation considerations section identify a priori the problems that might arise if we implement those policy options. And as such, we identify all the counter strategies that are needed to be implemented with the policy options in order to avoid those barriers and to overcome those barriers. Where to find the implementation considerations information? We can find them from systematic reviews that have outlined the policy options. So in the same systematic review that you've identified the policy option, sometimes you can find the implementation considerations. On the other hand, sometimes you would find systematic reviews specifically on implementation considerations. So you could find those this section from there. Systematic reviews of qualitative studies are also a great stop to identify the implementation considerations for a certain policy options. Remember that implementation considerations should also be context specific. So definitely I should identify all the barriers and the facilitators that have been identified in different contexts. However, I should also identify the system level barriers and other barriers that might arise in my context. How do I get this information? It's mainly through local studies, through different interventions that have already been implemented in the context and have shown to have barriers. Then you could add those barriers into this section, or from stakeholder interviews. As Rasha mentioned from a while, she mentioned that we should always have stakeholder interviews to get their feedback on the policy options. In those interviews, we could ask them about what the barriers in our context might be and what the facilitators could also be. These could be added into the policy brief in order to contextualize the evidence and make sure that this evidence speaks to the local context. Does anyone have any questions? Is it clear on how to identify the sections of the policy brief and the implementation considerations? Definitely, once you start developing your policy briefs, we will go with you step by step in the process of how to develop the policy options, the implementation considerations, and how to definitely write the policy and the problem statement. We are happy to coach you in details on that and have individualized meetings as such. As for now, we are open for questions about the policy options and implementation considerations before we finalize.
Yes, sure. We will email the presentation later on to all participants, so you don't have to worry.
Okay, great.
Okay, so this is a quick quiz. So we have 6 statements. Which statements are false? Or maybe all of them are true. What do you think? So which of the following statements are false? So someone said 3, 4, and 5 are false. Three, 4, and 5. 3 and 5. So yes, definitely. So 3, 4, and 5 are false because, as we mentioned earlier, policy briefs do not provide recommendations for action. Policy briefs are definitely not static documents because, as we said, once we have an outline, we do something called litmus testing, where we go to key policymakers and stakeholders to elicit their inputs on the different dimensions and features of the policy brief. And 5, so policy briefs are definitely context specific. So they start with a problem statement which contextualizes the issue. Okay, so let's say you have prepared the policy brief. What's the next step? How do you use the policy brief? What do you do with it? You can convene a policy dialogue.
Excellent.
So exactly, one of the most common ways to use a policy brief is to inform policy dialogues. And this is where you get the chance to actually involve stakeholders and policymakers. So basically, in a policy dialogue, you bring together policymakers, stakeholders, and researchers to deliberate about a policy issue and agree on an action plan for action and implementation. And of course, these dialogues, they use the policy brief as a starting point for deliberation. And this is an example of the policy dialogue we held on rational drug prescribing, and the dialogue was informed by the policy brief which we have developed. So ideally, you would pre-circulate the policy brief to your participants at least 3 weeks before the dialogue, and you would also use the brief during the dialogue as a starting point for deliberation. And hopefully by the end of the dialogue, your policymakers and stakeholders would agree on an action plan for implementation based on the policy options and elements that you have proposed in the policy brief. So, any questions from your end? So, if you have any question, this is the opportunity to ask now.
Okay, there was a question about convening a policy dialogue and how do we manage such a large group of people during the dialogue to ensure everyone contributes.
So before I answer, I just want to mention that we will have a completely separate webinar on policy dialogue because it's a whole different knowledge uptake activity. But if you want Rana to give a brief
yes,
answer.
of course. So usually once we convene a policy dialogue, we would have done our homework before. So what do we do usually is that we engage with stakeholders right from the beginning of the policy brief. Those stakeholders that we cannot afford but to engage, and we get their feedback on the policy options and implementation considerations even before the dialogue. So we would know what their reactions would be, and then we would change the policy options and the policy brief based on their feedback. Definitely if it's supported by evidence. If not, then we would not change it. And then once we identify those key stakeholders that we cannot afford but to engage, we invite them to the policy dialogue, including other stakeholders that we sample based on a standardized sampling criteria that we will share with you at a later stage in the mentorship program and during the dialogue of the policy, during the webinar on the policy dialogues. In those policy dialogues, we usually engage with 20 to 25 participants, those who are at a high level position in their institution, so that we get information about how to move forward with the implementation of those policy options, and we get their stewardship and leadership into implementing those policy options. We would usually invite stakeholders such as researchers, NGOs, governmental and other non-governmental organizations, and citizen representatives. We wouldn't engage with more than 25 participants. Other than that, the dialogue would become unmanageable. And definitely before we start, we set ground rules on how to engage with the policy dialogue. So we usually describe the problem and give them feedback, give them time for feedback, where we get their information and we get their feedback on the problem definition. Again, we do the same at the underlying factors. We explain the underlying factors and then we get their feedback for around half an hour. And then we start outlining the policy options along with all the information on their cost, harms, benefits, and cost effectiveness and other stakeholder reaction. And then we would get their feedback on how these policy options could be implemented in the context. We will go into details into the next webinar on policy dialogues. However, this is an example of how we usually go about policy dialogues. There was another question about if the policy brief does not get the required traction, what would you do next?
So this will actually be part of the next webinar on the policy on uptake activities. So what are the different knowledge uptake activities that you could engage in?
Yes, of course, the policy brief is a document by itself that wouldn't reach to the impact if we don't engage with the right approaches afterwards.
So dialogue is one example. There are other types of engagements that you should be involved in if you really want to make impact at the end of the day. And this will be discussed separately in a different webinar.
Yes.
So if there are no additional questions, I guess we can wrap up. So hopefully, through this webinar, we were able to provide a brief overview of what policy briefs are, what are the key steps involved in preparing policy briefs, and what are the different types of evidence that can be used to inform the policy briefs. Of course, we will follow up later on with our different peer-mentee institutions to provide detailed technical support with developing the actual briefs. So thank you everyone for attending.
Thank you for your time, and it was a pleasure.